With more than 12.5 million people affected and over 560,000 deaths across the world, COVID-19 has changed our lives. While researchers continue to work on a vaccine for this pandemic, convalescent plasma therapy has emerged as a promising intervention to cure COVID-positive patients. So what is plasma therapy? Does it really help to treat COVID-19? Welcome to Simbly Curious. Today we are listing down a few facts about this method of treatment. Number 1. What is convalescent plasma therapy? Simply put, this is an experimental treatment where the antibody-rich plasma from a recovered patient is injected into an infected person in order to kickstart his or her immune response. Plasma is the colorless part of the blood, made up of salts, enzymes, and antibodies along with other proteins. Number 2. Who can donate? The antibodies to fight COVID-19 are present only in those who have recovered from the virus. So those who have fully recovered from the SARS-CoV-2 virus infection for at least 2 weeks can donate plasma. Apart from this, there are also certain criteria such as that they should be fit, healthy and above the age of 18. The individual should have enough blood to donate safely. The people who cannot donate plasma are those who are breastfeeding or pregnant, those who are HIV positive, or a carrier of hepatitis B, C, or are HTLV positive. Those who've ever had or have been treated for syphilis cannot donate plasma, and also those who have ever injected or been injected with drugs, even only once, such as bodybuilding drugs, injectable tanning drugs, etc., cannot donate. Number 3. So how does it work? The process for donating plasma is similar to that of donating blood, just that it takes longer. Plasma donors are hooked up to a small device that removes the plasma while simultaneously returning red blood cells to their bodies. This process takes about an hour. Number 4. Does this really work? Convalescent plasma therapy was used with some success during the 2003 SARS pandemic, the 2009 influenza H1N1 pandemic, and the 2015 Ebola outbreak in Africa. Researchers across the world are working on clinical trials to prove its efficacy in fighting the disease. But the success of emergency administrations to severe cases of COVID-19 has got the entire world looking at this option in the absence of vaccinations. Number 5. What are the advantages of plasma donation? Apart from the deep satisfaction of actually saving lives and helping reduce the severity of the virus in another person, plasma donation helps in removing the unwanted toxins released in your body because of the virus. Also, it is a no-cost way of testing that you are 100% virus-free. Otherwise, according to the Victoria Hospital, Bangalore, the screening test costs nearly 20,000 rupees. Number 6. Are there any risks involved? The risk of infection of COVID-19 is a myth. The plasma is screened to ensure the risks of any infections or virus transmissions is very low. And just like blood donation, this does not cause any weakness in the donor. Ironically, even though the demand for the therapy has gone up, the number of willing donors is yet to pick up because of all these possible myths. Several organizations like the Sai Krishna Charitable Trust and the Victoria Hospital are working closely with each other to get COVID-19 recovered patients to come forward and donate their plasma in order to help others and end the pandemic soon. So what can you do? If you are a recovered COVID-19 patient, we are so glad that you are safe and healthy now. It must have been really scary and difficult for you, but you and only you can help other patients to recover fast by donating your antibody-rich plasma. And if you've managed to stay safe from the virus, then please pass on the message and help break the unwanted stigma around this pandemic.